The Professional Support Unit, the PSU, an induction for educators. This presentation gives an overview of the Professional Support Unit, what resources we can offer and how both residents and educators can access them. The PSU provides free developmental support for resident doctors and dentists in London, Kent, Surrey and Sussex, from Foundation to CCT. PSU services can enable residents to progress in training and make an effective contribution to health service delivery in this region. Please note, KSS Foundation and GP residents are now supported by the KSS Professional Support and Wellbeing team. Accessing PSU services is normally through resident self-referral, where residents can discuss issues in confidence and impartially away from the workplace. An educator referral pathway is also available if discussed with the resident beforehand and gaining their consent to contact us. Examples may be around ARCP outcome concerns or recommendations or well-being concerns for residents. We will then contact the resident directly. We see on average 1,500 doctors and dentists a year from the region who can access a variety of services. The PSU also works closely with the London Faculty Development Team, who provide developmental workshops to educators. So who works for the PSU team? As you can see, our team is made up of both clinical and non-clinical specialists, including educators, coaches and linguistic experts, who often utilise a multidisciplinary team approach to meet resident needs in service provision. We also currently commission expert neurodiversity partners to offer assessments and neurodivergent coaching to residents where eligible. So what are the common challenges during training that cause residents to ask for our help? Or when may it be applicable to signpost the PSU? As you can see, the challenges are diverse and complex and often overlapping. I will now go through each reason in more detail. The challenge of examinations. Recurrent difficulties passing examinations is the commonest reason. Sometimes examinations may become a challenge for the first time in higher medical training, or studying for exams can be part of an ongoing issue dating back to school and/or university for residents. In addition, working long hours and busy jobs and having commitments outside work can add to the challenge. Sometimes not using the most productive revision approach can contribute. Unfamiliarity with exam technique may be an issue, particularly for international medical graduates, and performance anxiety may be another specific problem for some. Recurrent lack of success can create a vicious circle with loss of confidence and enjoyment of studying, making it more difficult to learn. Previously unrecognised dyslexia or other neurodiversity is something we always consider when residents report recurrent difficulties passing examinations. Relationships are another important reason for residents seeking support, and often these relate to senior colleagues and especially issues around giving and receiving feedback. We work in a highly stressful environment in healthcare with a lot of emotional pressures which can often lead to misunderstanding or misinterpretation and resultant behaviours. Risk and uncertainty, linguistic and cultural challenges can sometimes be an issue, especially for international medical graduates. Systemic issues are important, and there is a lot we can do to help each other through informal supervision and recognising when colleagues need support. When might it be worth considering neurodiversity? Although being neurodivergent can offer many strengths to being a clinician, the medical or dental training programme and environment can also offer challenges to many residents, particularly around exam preparation, interpersonal skills and executive function. We often see residents in the PSU who may have managed well with work and training up to a certain point, but are now struggling, or they may always have suspected they were potentially neurodivergent due to challenges in certain areas, but have never been assessed. Neurodivergence may be worth considering with your residents if there is a mismatch between skills, strengths and capabilities, and unexpected challenges in some aspects of life work training which they find very hard, but others seem to navigate easily. Examples are given here. Mental health challenges. Clinicians are not always good at seeking psychological help for themselves when it is needed, and fear of stigma and reluctance to consult colleagues may be important factors. Stress, burnout, anxiety and depression are relatively prevalent in healthcare professionals. Imposter feelings, perfectionism and guilt are all themes we often see described by our clients, which can impact on confidence and self-esteem. Career doubts. Career doubts are common and may include specialty, choice, type of consultant role, or sometimes whether to continue medical training. Career doubts sometimes reflect underlying problems, and it is important to reflect very carefully before making irrevocable decisions that may be regretted later. Life events and returning to work after a break. As well as being clinicians in training, residents are also human, and life events and pressures outside medicine, such as ill health, bereavement, divorce, addiction, and debt, can also impact on well-being and self-confidence. Returning to training after taking a break for maternity, paternity, additional training, academic study, or ill health can raise many questions, doubts, or fears, such as feeling unconfident in skill set and experience, or changes in career planning priorities. Not uncommonly, clients apply with a mixture of several issues, and we always try to gain as full an understanding as possible of the whole picture before making suggestions of support. So what services can residents access via the PSU? The PSU offer 4 main areas of support to residents in training, which can be accessed individually or sequentially, depending on resident needs and priorities, and they are one-to-one support, workshops, group support, and self-directed learning modules. Turning to one-to-one support first, the PSU offers a holistic bespoke approach to professional and personal development. Virtual one-to-one support services include the PSU advisor appointments and guidance single point of contact service for holistic triaging conversations, initial assessment, and signposting to relevant PSU and external services. The PSU coaching service, which offers specialist and impartial virtual one-to-one support to trainees. Common issues which trainees bring to coaching sessions include managing burnout, exam failure, challenges in returning to work, and impact of negative mindsets and limiting beliefs, which can affect confidence and performance. For example, imposter feelings or perfectionism. The coaching service also offers support to international medical graduates who may have little or no support or face challenges with navigating complex NHS systems and life in London. The Careers Unit offers virtual one-to-one guidance, advice and support for career decisions, doubts and key transition points, such as choosing or switching specialties, developing a portfolio career, as well as preparation for registrar and consultant roles and interviews. Neurodiversity dyslexia assessments and specialist coaching for difficulties related to exams in the workplace are offered. Further information will be provided in the next slide. The Specialist Clinical Communication and Linguistics Service. Common themes include addressing challenges in communication with patients, colleagues and carers, skills for effective and confident communication, preparation for communication-based exams, developing English language for clinical practice, and enhancing cultural competence. Challenging conversations can be modelled in safe, supportive virtual environments, similar to an OSCE, with developmental feedback given by specialist educators and linguistics. Turning to workshops, the PSU regularly deliver virtual half or full day workshops to resident doctors around core themes or challenges impacting on training or career progression, which complement the one-to-one service offer. Some key examples are a 3-session burnout series, which introduces residents to the beginnings of a CBT-informed approach to spotting and addressing burnout through core themes such as perfectionism and boundary setting, and the Preparing for Examination workshops, which cover areas such as time management, prioritization, procrastination, and mind management. Group support. The PSU runs an informal monthly online peer support group for dyslexic residents to connect and discuss any experiences, questions, or concerns they have. Information on how to sign up is in the workshops section of our website. And finally, self-directed learning modules. The PSU has developed a range of 17 bite-sized virtual modules focusing on supporting key concerns or issues that can form a barrier to successful training. Progression for resident doctors and dentists include assertiveness, personal and professional effectiveness, record keeping, and examination support. Diversity support. As mentioned, within the PSU, we're increasingly seeing residents who, although are generally confident, competent clinicians with a variety of strengths, find they may struggle with some aspects of clinical training due to their neurodiversity or suspected neurodiversity, which can prohibit their progression. The PSU offers support to neurodivergent or suspected neurodivergent residents in a variety of ways, which can include neurodivergent assessment, in which current challenges within both the working and educational environments are reviewed. This review may lead to the offer of a free dyslexia assessment with recommendations for trust, occupational health training program, and/or neurodivergent focused strategy coaching. The PSU neurodiversity assessments. The key to identifying those who might be dyslexic is inconsistency. The competent practitioner who fails professional examinations despite appearing to be well prepared, or someone who is very good at communicating verbally but takes forever to complete paperwork. We can fund an assessment for neurodivergence if the resident trainee have persistent experience and/or cluster of characteristics, strengths and challenges suggestive of neurodivergence, and the resident is struggling with progression in training or work as a result of these experiences, and assessment is likely to help or make difference in some way. Unfortunately, we don't have a routine clinical ADHD or autism assessment unit, but we can still potentially offer a neurodiverse assessment or coaching if residents already have an assessment depending on needs impacts highlighted. We can also support residents in exploring options for autism or ADHD assessment through the NHS or privately. Psychological support. Unfortunately, burnout and other psychological conditions such as anxiety and depression can be common to doctors and dentists, but not surprising working in stressful and emotionally challenging environments such as the NHS. There are a number of doctor and dentist specific as well as general resources that can be accessed to support emotional health and well-being whilst in training, which are listed here. Practitioner Health provides a free confidential psychological health service for doctors and dentists separate to mainstream NHS services, which can be accessed by self-referral using the link on this slide. The PSU also offers a number of wellbeing resources, including videos, podcasts and exercises on its wellbeing hub. Turning now to specific support for educators with an initial focus on differential attainment. The term differential attainment describes the gap in levels of attainment by different groups of doctors in recruitment, exam pass rates, and ARCP outcomes. PSU has created a differential attainment toolkit for educators, and this includes understanding differential difficult conversations, language, culture, and careers, coaching lesson plans, and PowerPoint presentations, which you are free to use and are available on the PSU website on the differential attainment pages, which are listed below. Please take some time to explore the range of resources on our webpage. The faculty development team run a number of courses and workshops for educators. These include advanced supervision skills courses that can also be held within trusts, multi-professional supervision skills courses, introduction to supervision courses, bullying and harassment for supervisors, supporting the neurodivergent learner, and the learning lunch. Our aim is to bring educators together to strengthen our educational abilities and consider the challenges of supervision, while ensuring peer support and connecting with others working across London. In terms of other feedback, it may be worth specifically mentioning that we run in-person SCA courses for trainees who have challenges with the exam. For example, have English as a second language, have failed already. Also, that we offer one-to-one SCA support for these trainees, which are 90-minute online sessions facilitated by a GP educator and linguist. Having looked at what services the PSU can offer, it's also useful to understand what services we can't offer but can signpost to. We do not offer representation, advice or guidance on any work disagreement, legal contract, occupational or financial issue residents may be managing, but can speak with them to explore how they might access support. How to access the PSU and find out more about us. Further information about all our services can be found on the Professional Development homepage under the Professional Sport Unit tab. Click on the QR code for further information. If you're unsure which PSU service may best support your residents, please signpost them to the PSU link here and we will assess their application and either make direct referrals on their behalf or invite them to a triage spot conversation to allow space to understand more context and content of any current challenges they may have linked to their training, to agree appropriate support with them. This concludes this short presentation on the PSU.